Welcome to our latest Frederick County Public Schools response to COVID-19. My name is Eric Loris Phillips. We are so fortunate here in Frederick County to have partnerships with various agencies across the county. Today, we have joining us Dr. Randall Culpepper from the Frederick County Health Department and Jennifer Waters, our Health Services Specialist. Thank you for joining us today.
You bet.
This winter, Frederick County Public Schools has navigated through a surge in COVID-19 cases in the community, much of it caused by the Omicron variant. In late December and January, Frederick County experienced record positive case counts. Even so, FCPS has remained open for students to take part in in-person learning, making this phase of the pandemic different than during past peaks, when we took part in either virtual learning or a hybrid model. Today, we wanted to share with you the latest on how the Omicron variant has affected our community and more details about our mitigation protocols. Dr. Culpepper, can you tell us more about why we have seen such high case counts in our community with the Omicron variant?
We had early indication that this variant was going to be more transmissible, likely more transmissible than the Delta variant, the Alpha variant, and even the wild strain we saw at the beginning of the pandemic. This variant has over 50 mutations in it, many of which are mutations for the spike protein. It's that spike protein on the surface of the virus that really allows the virus to attach to our system, to our receptors in our body. So if you've got a variant that has more likelihood of attaching to our receptors, it's going to be more transmissible. Because of that, we've seen since mid-November, or literally in 4 weeks, this one new variant has circulated the entire world, has become the predominant variant in so many countries, including the US and most all the countries in Europe. So again, it's because of this new mutations that it has, again, over 50 mutations, that makes it more transmissible. Because of that, we've seen what we've seen now. Our case rates in the US, globally, in Maryland and here in Frederick County, were anywhere 3 to 5 times higher than we've ever had in the past.
And with that, we have many individuals in our community who are concerned that we have students coming into the building, we have staff coming into the building, and the numbers are increasing. So how do we address that concern? What do we say regarding that?
Well, I can certainly understand why people would have concerns with kids coming back into buildings following the holiday with such a high surge with Omicron. What I would say is that schools have mitigating strategies in place to help to prevent spread of COVID-19 in schools. And so we have universal masking in all schools in Maryland, and particularly at Frederick County Public Schools. We also are very cognizant of our cleaning and disinfecting protocols, and we have screening reminders to all families and all staff to not, send your child to school or come to school yourself if you have any symptoms of COVID-19. And we also make sure that anybody who does present with any kind of symptom of COVID-19 is sent home and asked to be evaluated before returning to school. And then we are also quarantining anybody who was identified as a close contact and met the criteria to need to quarantine at home.
So while one could possibly contract COVID in a school, it's not as likely because of the mitigation strategies that are in place.
Sure, it is possible. We know that kids during the lunch hour oftentimes are not wearing their face covering because they have to eat. We try our best to separate kids as much as possible, especially in the younger grades. We can't do it all the time. So there are potential areas where a child may pass the infection to others, but we're not seeing it. Same thing for our extracurricular activities, sports, and all those other activities where the kids are grouped together. We've worked really hard over the past years to make sure that we can allow kids to continue those important parts of their education, especially extracurricular activities such as sports. We've learned really over the past 2 years how important that is. We've always known that, but we've really learned how important it is in this environment to try to allow the kids to participate. And so we put together, along with Jen and other folks in the community, we work every week, meet every single week and talk about what measures we have. We talk about if there are any outbreaks among sports teams, for example, and just make those recommendations so we can minimize those risks to our kids.
Thank you both for sharing that. We certainly are concerned about many of the fears that some in our community have, but ultimately our goal is to make sure that our students remain safe and protected, as well as our staff when they're in our school buildings. So Jen, we do know that when there is a case that has been identified in the school, are we still following the same procedures when it comes to sharing information with families?
Yes, Eric, we are continuing to communicate with families. If there is a case of COVID-19 reported in a particular classroom, those families are notified that an individual in that class has had COVID-19. Also, if any close contacts to that individual have been identified at school and they meet the criteria to need to quarantine, we are also notifying those families individually to let them know that they were in close contact and that the appropriate quarantine timeline for their child. And then importantly, if we do have any Maryland Department of Health identified outbreak of COVID-19 in our schools, the school administrator will provide communication to the entire school community through Find Out First.
How do we define an outbreak, and what happens when one is confirmed?
Okay, that's a good question, Eric. So the Maryland Department of Health provides a couple of definitions for an outbreak of COVID-19 in a school. And one is called a cohort outbreak of COVID-19. And to meet the criteria of a cohort outbreak, then there would have to be 3 or more individuals, either in a cohort or classroom, that are not related or household members who have reported having COVID-19 within a 14-day period. And then there's a second definition called a school outbreak. And what happens in a school outbreak is that there are at least 5 cohorts within that school who have met that previous definition of a cohort outbreak. Or if it's identified that 5% or greater of that whole population in that school has reported to have COVID-19 during that 14-day period, then that would be a school outbreak.
Thank you for sharing that, Jen. And I know that our community can find additional information on fcps.org or on the Maryland State Department of Health's website when it comes to schools that have been identified as having an outbreak.
That's correct.
So what happens if a student reports to school exhibiting COVID-19 symptoms?
That's another good question. So if a person reports to school, particularly a student, and they're exhibiting symptoms, primary symptoms really, of COVID-19, then they are they're sent to the school health room where they're evaluated by our school health staff. School health staff will then call the parent and have them come to pick up the child. And then the parent is given instructions about what are the requirements for the student to come back to school. And so those requirements are to either have a COVID-19 test that is negative, or an alternate diagnosis from their healthcare provider, or if they test positive or they're not able to get a negative test or a different diagnosis, then they're provided with the appropriate isolation guidance and date of return to school.
So one of the things we've seen over the past couple of weeks is that there have been at-home tests that have been distributed. If you've signed up, you can get 4 free home at tests through the federal government. We also see that there is a new direction as far as individuals being able to access K95 masks if they would like. Dr. Culpepper, why are state and federal governments working so swiftly to distribute masks and COVID-19 test kits for home? How do they help?
So one of those layers of our strategy, mitigation, is to provide everybody with the most effective face coverings as possible. And you probably heard recently the CDC has once again said that this type of face covering, the KN95 or N95, provides the best protection, not only for me to prevent exposure from somebody else, but also as source control, if I were to be infected, protect me from infecting somebody else. So they're working hard now to pass these kinds of face coverings out to everybody. This isn't new. We've known this since the beginning of the pandemic. We've always known that these are the best face coverings. The second best would be a surgical mask that a lot of people see the blue mask coverings. The next would be cloth masks. And probably the lowest level of protection, but still somewhat effective, would be wearing the gaiter where people pull the cloth up over their nose and mouth from their neck. Now that we have availability of so many at-home tests, And now that we understand the characteristics of these tests and how best to interpret them, we're just trying to get as many out to the people as possible. When you have so many cases we've had right now, it's hard to do case investigation, contact tracing on every single individual. It's impossible, actually. So if we can get testing out to the community and teach the community, test yourself. And here's what to do if it's positive. You don't have to wait for one of us to call them and say, your test is positive, this is what you have to do.
Thank you for that. And you gave several examples of the different types of masks and the purpose for being able to self-test to see if you have COVID-19. And while we don't have gaiters in our schools, we do allow for different types of face covering. So for example, the three of us are wearing two different models, K95, you and I, Dr. Culpepper, and Jen, you have a cloth mask. So we know that not everybody is able to get access to a K95 mask, but we do have other face covering options that our students and staff and families can wear when they visit our schools. So Dr. Culpepper, it seems that we have learned a lot about COVID-19 and we have more tools in our toolbox to combat infections. Is this why so many health experts believe schools should remain open to in-person learning?
That's a complicated question, but let me share with you this. When schools across the world went into virtual models of education back in the spring of 2020, I don't think anybody expected at that time that the pandemic would last 2 years, for gosh sakes, no. And so that was really the best option at the time. We didn't know enough about the virus. We didn't have any mitigation measures in place. We had no vaccines. We're just beginning to do case investigation and contact tracing. And so that was the best thing we could do at the moment to protect our children and our staff and our teachers, is go to pure virtual education. Since then, as you know, a lot of school districts followed that with a hybrid type system, allowing parents and kids that wanted to be in class to be in class. Those that didn't feel comfortable, do it virtually from home. That's the hybrid model, right? But since then, I think we've learned so much over the past 2 years that being in pure virtual mode has really had a negative impact on so many children, especially in the grades K through 12. And so I think most governments, all public health experts, have really worked as hard as they could to try to make an environment, make a setting where the children can come to school as safe as possible for them and for our teachers and our staff, to allow them to stay in school, because we know how important that is to get education person to person with your teachers. So that's not because of anything to do with the recent rise or because we have masks and we have this or that. Just, I think we've all have probably changed our understanding of the impact of this pandemic on so many aspects of our society over time.
Why is it now important to have this conversation again? Why are we presenting this information to our community right now?
And I think Jen would agree that these work. Face coverings work. They really work. Vaccinations work. They prevent infection. I've had people say to me, but Randy, why get vaccinated? They don't prevent getting infected. Well, they do.
I'm thinking about when I've gotten the flu shot in the past, and then a couple months later, I then have the flu. So you said that when one has a vaccine, it prevents them from getting that virus. Can you talk a little bit more about what you mean from that?
No vaccine that we have, no vaccine, whether it's for measles, mumps, rubella, shigella, doesn't matter. No vaccine is 100% effective against being infected. Same thing with the coronavirus vaccines. None of these are 100% effective at preventing disease, but they can prevent disease. And we do know that there are breakthrough infections. That is, someone who's been vaccinated and gets infected afterwards. That's a breakthrough infection. That does happen, but not nearly as high as if you're unvaccinated and getting infected that way. So bottom line, vaccines work. They do what they were designed to do. That is to reduce the possibility of being infected. And I think for the mRNA vaccines, about 80–85% effective. Number two, if someone does get infected, those who've been vaccinated, especially those who've had all of their doses they're eligible for, including booster doses, that means their immunity level is as high as possible. We know for a fact that those folks are much less likely to have severe disease, much less likely to be hospitalized, and much less likely to die from the disease. Right now, for example, at Frederick Health Hospital today, 2/3 of the patients that are inpatients are unvaccinated. 1/3 have been vaccinated. Of those 1/3 who've been vaccinated, I don't have data whether or not they're up to date. In other words, have they had their booster dose? Have they had all eligible doses that they could get? But bottom line, vaccines do work as they were designed to do. Reduce the risk of infection, prevent death, prevent hospitalizations.
Okay. So if I've had all the vaccination shots and the booster, and I still come down with COVID-19, it is because I've gotten a variant that was not covered by the booster and the shots that I've already received.
No, that's not true. All the vaccines we have do work against all the variants we've seen to date.
Well, thank you both so much for sharing your expertise with us today. We appreciate it. FCPS remains committed to sharing our COVID-19 response with the community. We will continue sharing updates via Find Out First, fcps.org, and our social media channels with the latest. Thank you for joining us today. And until next time, please continue to take care of yourself, take care of each other, and be well, everyone.